So welcome, Andrea Grunier?
Gruneir.
Oh, I got it right. And Stephanie Chamberlain. We're very happy that you're here with us today. I should say doctor.
Yeah.
And soon to be doctor.
Yeah,
soon to be doctor. Stephanie. So welcome. We're really happy that you came to join us for our Greek to Street event. In that we're talking knowledge translation at KT Canada's annual scientific meeting about not only the art of communication and translating knowledge, but the science behind it as well. Andrea, you come from the School of Public Health, so you have a PhD in epidemiology.
So I'm actually based at the Faculty of Medicine in the Department of
Family
Medicine.
Okay,
At the University of Alberta.
Fantastic. And population health, you look at big groups of people and what happens to them.
Yes, so I focus a lot on health services research related to older adults, but I do use often large data to understand large-scale patterns of how older adults move through the healthcare system and where there are concerns about what's happening.
Oh, very cool. And I mean, older people are moving through the healthcare system more frequently than other populations, I'm guessing.
Yeah, older people use the healthcare system more often than most other age groups. In particular, where we're particularly interested in is around the use of continuing care services.
Okay.
So that's both home care and Alberta supportive living services, and in particular long-term care homes or nursing homes, which is what our work here has focused on.
Okay, so care beyond the hospital. In other words.
Definitely. The
Yeah.
hospital is like the place of last resort. That's what we think of it.
Yeah. With autoimmune arthritis, which I've lived with for 30 years, we have this saying around the patient world, the last place you want to be is the hospital.
Mm-hmm.
You want to do as much as you can outside of that setting. Stephanie, you're in the School of Nursing.
Faculty of Nursing.
Innovations in Seniors Care Research Unit, so again, working in gerontology.
So I'm actually in the Translating Research and Elder Care program,
Okay.
which is in the Faculty of Nursing at UOA.
Okay,
Yeah.
okay, fantastic. And tell us a little bit about your work. What do you do every day?
So my work focuses on
Just a little question,
on
right?
improving the quality of work life for staff that work in long-term care homes, as well as improving the quality of care to the residents that they're working with every day. So, yeah.
What have you, in the work that you're doing in your doctoral training,
Mm-hmm.
what is of specific focus to you? What's your thesis?
So my dissertation research looks at people who are socially isolated and live in long-term care homes. So I'm specifically looking at people who don't have family or friend decision makers, so they have under the care of the public guardian, and what that means for their quality of life and if they have any unmet needs as a result of that. So looking at those individuals who are particularly vulnerable in the system and if that has an impact on their life.
Is there a difference, and is it significant?
Well, I think there is a difference, and the level of significance is really based on what you value as important. So these people have a real challenge getting adequate social support, and they are very isolated. They don't have external visitors. They don't have people who are advocating for them and who are being a really continued presence in their life. And in some cases, it does seem that there is a difference in the care that they receive because they don't have that close family member advocate. So potentially more trips to the hospital, or maybe care that isn't necessarily something that other people would want if they had someone on a continual basis watching out for them. So I think there are some significant differences, but there's also some resilience in the staff that are providing their care, and they really step up in a very important way for these residents in a way that they don't necessarily have to for people with family members. So I think there's some real challenges, but I think the people working in the facilities are really stepping up for these residents.
And the science part of what you do is looking at how they step up, the providers?
In some ways, it's looking at the different ways that the system provides care to these individuals, so at both a care provider level, but also at like an organizational or public policy level. But it's also looking at using data to see if there's service differences or if the care that they're receiving might be different. So it's using lots of different methods to try and see what their experience is like in long-term care homes.
Very cool. So to both of you, you were here co-presenting a poster.
That's right.
And the poster title, Effectively Evolving Together, which I just love the opening of that poster title. Well done. Lessons on Citizen Engagement in a Large Health Services Research Team.
Yes.
So maybe I'll start with you, Andrea. Tell us how citizens were engaged.
Okay, so I'll start off by saying that the title actually came from one of our citizen partners, the one who is based here in BC. She was the one who suggested it. So as Stephanie mentioned, she's involved with the Translating Research and Elder Care program, which is based out of the Faculty of Nursing at the University of Alberta. And the short form for that is TREC. TREC is an 11-year-old now program of research really devoted to improving the quality of care provided to residents of nursing homes or long-term care homes across the country, as well as improving the quality of the work life for the people who provide care to those residents. Okay. One of the key features of TREC is that it was developed very much in partnership with decision makers. So largely people who were either at Ministry of Health or Health Authority levels who had some jurisdiction over the way long-term care homes operated. But one of the things that started to be recognized within the last several years was that the resident, family member, sort of so-called patient voice was lacking. So in late 2015, an effort was started to create what would then look like a patient kind of advisory council.
Right.
For a number of reasons, we moved away from using the word patient, and that's why we use citizen in this case. And one of the things that we learned was that what we had envisioned for how this advisory council might operate actually didn't really make sense, both in terms of what people were hoping to participate in when they signed up for this kind of advisory council, as well as for actually where TREC as a larger research program was going. So over the last 2.5 years now, there's been a lot of negotiation back and forth and listening and trying to understand, okay, what is it that we can do that will really make this work, both for the citizens who signed up to be part of this, as well as for TREC more on a larger scale. Mm-hmm. And that's what our poster gets at, is really some of the lessons that we've seen over the last 2.5 years and having those conversations.
So what were some of those lessons? What are the pearls?
Yeah, so I think the first thing was communication. So between us and there's a number of staff members and there's some support on the team, you really have to have a point person who's involved and who's their point of contact. And we learned this over time, if there was different people sending messages, and that we really needed one person to be that point of contact. And another thing that we learned was always closing the loop. So sometimes they'll ask us questions and they send us a lot of emails and interest, and we really needed to focus on always making sure they got an answer, because they would follow up with us and they would want to know what the progress was on activities. And so that was a big learning for us. For our group, because we have individuals that live with a dementia and we have individuals who are caring for those that are living in long-term care homes, we really had to start changing the way we do our work. So things like meetings. We had to start structuring the day around people's needs. So having an agenda that goes into late in the afternoon and having the expectation that people would be participating and giving feedback is just not reasonable on someone with a different health condition. And so we really had to learn, after making some mistakes, that we thought, we can restructure this, and really asking them, how do we better provide these meetings in a way that's actually going to be engaging and that you're not going to feel like you have to really struggle through the rest of the day. So I think that was a big learning for us. And also, with our investigator team and our decision makers, we've worked together for a long time in this kind of integrated model, but we hadn't included that citizen voice. And I don't think we expected so positively that the decision makers would be so on board. Mm-hmm. They are really thrilled, they're really excited, and they really see the value right away. But it's been a bit more of a journey with the investigator team, because there's not training. Like, researchers aren't trained necessarily from the beginning of their career how to do this work. So they were excited about the idea. They really supported the goals of it, but they didn't know how to actually put that into practice. So they don't know how to write grants with citizens. They don't know how to work on papers or work on projects. And so there's been a lot of work of how do we actually do this as a team.
Just the basic nuts and bolts.
Yeah.
How do you do it?
Yeah. So it's one thing to say, we really want citizens on our team, and everyone sees the end goal and they see the value, but saying, but how do we actually write a paper with citizens? What's the expectation for us and for them? And so that's been a real learning opportunity, and I think the team is really growing because of it.
Yeah, it's interesting. As a patient or a citizen engaged in research processes myself over the years, it's always something that's being done to me.
Yeah. And
so it's very refreshing to hear that, you all recognize, well, actually, we need to do something. Yeah. From our own perspective, from our own processes, or even approach. Mm-hmm. psychosocial, psycho-emotional approach even to the work, which I applaud you on. I think that's a big step. And for citizens who are engaged, and I suspect, having worked with policymakers for a long, long time now, the value they see is there's a voter sitting at the table, right? There's someone who pays taxes, is a funder of the healthcare system and health research as well, obviously. And that brings an accountability, I think, to processes, and it also brings a measure of transparency, which we know accountability and transparency are valuable qualities to have baked into your environment, into your work, into your daily lives. You know, we all hope to be accountable and transparent in the way that we do our business as human beings. Yeah.
I think the other thing too is one thing. It's very refreshing to see when we work this closely with the decision makers is really how much they care, right, about what they do. I think sometimes people who don't get to see that side just sort of think, bureaucrats. But these are people who really, really
good. The bean counter
care.
complex.
Really care and really want to hear, what do the people who are going to be impacted by these policies and these decisions, what do they think? How is it truly going to affect them? What's going to go on there? So it's actually a very interesting environment to bring that three-way partnership together between the decision makers, between that citizen, and between the researchers, and to see, you know, what's going to come out of that we wouldn't have seen if we've not been able to bring those three sides together.
Yeah. Do you think that viewpoint of the policymaker, that they're excited, engaged about it, around it, is partly because it's still somewhat novel? Do you think that sort of the bloom will go off the rose a little bit as we get deeper into, I guess, entrenching, if you will, citizen engagement or patient engagement, or do you think the value the perception of it will just continue to grow and be valued?
In Alberta, at least at a provincial level, so involving Albertans in policy is like enshrined now in a lot of our politics. And so they don't call it necessarily citizen engaged policy development, but the belief that when you are developing work, you had to include Albertans in the both conception and the discussions around that is a pretty firm policy direction that in our province they have taken. So so the idea that the bloom will go off of it, I mean, the skeptic says, yeah, maybe it'll be, but I do think that there's an increased push, even without them realizing it, that they are moving towards a more accountable, public-facing development and kind of assessing some of the work that they're doing, especially, you know, we can really only speak to continuing care policies ourselves because that's where we work.
Sure.
But I think that people that are developing, at least provincially and regionally, those continuing care policies, they've always believed that this was probably the best way to go, but they didn't necessarily have the full force of a government who's really interested in it. And so I think now there's a real movement in their, from what they're doing from a policy standpoint.
Well, I find that absolutely great news, that's your opinion, and I think you know, there are naysayers out there, and I tend to tune those out. I tend to think the glass is half full. It's just a question I have because, you know, we see as patients engaged in research or citizens, whichever term you wish to use, you know, there are some in research who say this is sort of just the flavor of the day. I'm sure you've heard that as well. And that's why I asked the question. And I think your comments, Stephanie, are spot on. That the people that are the paymasters have to bake in those principles into the policy.
Yeah.
That if it's embedded or enshrined, as you say, in what it is as a government you say you're going to do for people, then you protect that for future. But I think there are actually still quite a number of researchers who feel, oh well, this whole patient engagement thing is going to go by the wayside. And what would you say to that person?
So I would argue that's part of what drives some of the things that we've done around the citizen engagement group, which is called Voices, connected to Trek, because we can see that attitude very easily, right? Not just within Trek, but all over the place, right? And that's what we feel is very important to see, okay, well, how is it that people are actually doing this? It was great to hear people's stories of how they actually engage with their citizen or their patient or their client partners, whatever language they're using. And to get people talking about the methods that they use to do that, the actual logistics of bringing people together, how they elicit information, as well as how they really feel it impacted on that work, and what can they show that really made that difference. I do think it's important because when you hear stories like the talk this morning from Dr. Nick Vansback about how looking at what patients really value in terms of outcomes and side effects, and you think, okay, well, why wouldn't you do that for clinical trial? Going forward,
Yeah.
why would you not think about putting that into all the...
Why wouldn't you want to know what the Apple iPhone buyer wants before you build it? Yeah.
When you hear it that way, it really sharpens, okay, this is why this is really, really important. And so I think the more we can document and the more we can get out that message to everybody, but you're right, in particular researchers and investigators, as well as give them the skills to feel comfortable in taking on that engagement, since none of us really learn it. I think the more part of normal operations it will become.
So in the curricula across the country, we then, it seems, need to have new courses created that teach our young up-and-coming scientists how to engage citizens in the research. Is that happening?
I don't know.
I think the provincial SPORE support units are trying to develop training for researchers and different teams.
Okay.
I don't think it's necessarily consistent across the country, and I don't think there's like a curriculum that's being developed. I think that's a big need, and we're a part of a large health services research team, and there are other similar teams in size and scope, maybe with a different focus, and they involve a lot of trainees, so masters, undergrad, PhD, postdocs, and so I think they're a real opportunity to train the new kind of crop of researchers that this is the way we do things.
Right.
But, the training is one big piece, but it can be a real challenge because we all work in university environments, and our promotions and our getting jobs are not tied necessarily to our citizen work.
Yeah.
And so there's a big movement, especially in the KT community, to show universities how to value integrated knowledge translation and how to give merit to people who are spending lots of time developing these long-term relationships that ultimately will make the work better and that we think ultimately will improve quality of life and quality of care, but don't necessarily check a box on a 10-year application.
Yeah, that was mentioned by Cara Soro, who was just being interviewed earlier in the day. And I asked her about her observations of, coming along through academia, now close to entering her postdoctoral phase. And she said, ultimately, at the end of the day, you have to get a job.
Yeah.
And there's limited faculty positions and things like that. And it seems to me there is enough science now that's developed around patient or citizen engagement that we have frameworks, right? We know kind of how to get it right in certain research environments or care environments, and for it to be standardized, I think, is advantageous for not just the system and the people working in it, but also for the public who looks at it and can see some measure of standardization across the country. That an Albertan has, that a British Columbian has a similar opportunity to an Albertan to engage in the area of research that you're in, I think is important. So I think there are things from the KT Canada Annual Scientific Meeting we can take away in terms of measurement, framework development such that we can measure. But I just want to thank you for coming in and talking to us. Your work is fabulous. I'm over 50 now, and I'm part of that aging, huge onslaught of patients coming into the healthcare system. Well, I've been in because of my autoimmune disease for quite a number of years. But our population, the demographic that we're in and where we're moving, the work that you're doing in the elderly population is invaluable. I mean, I'm going to be that client. We're all going to be that client eventually, whether we have someone caregiving with us in the system or not. So I really applaud your efforts, and thank you for engaging people like me so meaningfully in your work. It's really fantastic.
Thank you for
Thank
having
you.
us.
Yeah. We can't wait to talk to you again in the future, and we wish you well through the rest of the meeting.
Thank
Great.
you.
Thank
Thank you very much.
Yeah.